This is Jesse Dillon. You are coast to coast and worldwide today on The Revolution, the Good Life Revolution. We're talking about diabetes today on the Wall Street Business Network. Many of you have high-stress jobs and don't eat right. And I know it's not a laughing matter, but diabetes affects 28 million of us in North America. And inside the next few decades, it could balloon to 1 out of 3. Somebody is doing something about it. And that somebody is ALR Technologies, ALRT.com. The president has joined us today, coast to coast, for The Revolution, Mr. Bill Smith. Bill, thank you again for joining us today.
Thank you, Jesse.
Bill, I saw you interviewed on Fox Television recently where, if I'm hearing correctly, Medicare may be moving to cover these kinds of home devices, such as the Health eConnect.
Yes, actually, Medicare may put physicians in a position to pay for these types of devices, is basically what the proposal is. So Medicare, as you know, doctors get paid when a physician walks in physically to their office or to the operating room, and the physician sees the patient physically. Then the doctor can send a bill to Medicare and get paid. What Medicare is proposing very recently, and we won't know if it's final until later this fall, but what they're proposing is to pay doctors for some of the behind-the-scenes work that they do to manage patients who have chronic disease. So, doctors' offices may track down test results. They may check in with the surgeon to see how the patient's surgery went. There's a lot of work that happens when the patient isn't physically in the office. So the Medicare is proposing to pay physicians to do that. What that means for our company is that if we are managing a patient behind the scenes, looking at their blood glucose data and their trends, and working with the doctor's office and talking about the test results, the doctors potentially could be paid for that work and in turn pay LRT for our services. So it's a very exciting development. As I said, we won't know until probably early November whether this proposal will be made final. And if it is, physicians could start getting paid January 1st for managing diabetes patients in the way that ALRT likes to manage them.
So, Bill, ALRT's Health eConnect, this new remote diabetic medical device, could actually be in the hands of every doctor in North America in the very near future if this goes through.
Well, I'm hopeful that it would. As representing the company, yes, we think our device can assist patients foremost, and secondarily can help doctors who are so busy and don't have time to look at a patient's blood glucose data on a regular basis. We can do that on behalf of the doctor and help the patients, give them advice, and stay in touch with them. So we're very excited about it.
Bill, over the years, we've had Mike Roizen, chairman of wellness at Cleveland Clinic, author of You, the Owner's Manual with Dr. Mehmet Oz from the Dr. Oz television show he's been on many times. Sanjay Gupta from CNN, the renowned anti-aging specialist at Johns Hopkins, Dr. Jim Hill, former president of the National Institute of Health. I've had all of these doctors on this show many times over the years talking about diabetes, but what ALRT has with Health eConnect and what you're talking about, this is absolutely cutting edge. It is revolutionary. Who else has such an FDA-approved device? Do you have competition?
Yeah, there are several companies that have competition. We think we have a unique offering in that some of our competition simply sends the data to the doctor and asks them to look at it. And we just don't believe that, particularly in the primary care world, those physicians have time to be blitzed with all this data. So our sort of unique business model, and I think the advantage we have over some of our competitors, is that we have certified diabetes educators behind the scenes looking at the data online and then only contacting the doctor when the trends are so worrisome that the doctor needs to be brought in. And in some cases, the doctor doesn't need to be brought in. Our folks might say, hey, your blood glucose is up a little in the evening, Mrs. McGillicuddy. Are you doing something different? The glucose levels don't rise to the level of a doctor's intervention, but maybe we need to touch base. So our behind-the-scenes human touch with real people and real clinicians looking at the data on a regular basis, we think that's our unique contribution.
Bill, when you wake up in the morning and you think of the 28 million Americans currently suffering with diabetes just in the U.S., and the hundreds of millions worldwide that ALRT is in a position to help, how does that make you feel? And what are you most excited about for the future for ALRT?
Well, it makes me feel quite good. I mean, there are a lot of people who are in a lot of different professions, but one that's helping people's health, I can't think of one that could be superior. Diabetes patients, it's a very complicated disease. If you're on insulin, you're doing blood glucose readings, you're adjusting your dose, you're doing a lot of things. And our company, I think, would give a place for people to go and say, hey, what about this and what about that? We could answer their questions on a regular basis between their physician visits. I think it's something that the market really needs. And you mentioned all those experts. There are unbelievably smart clinicians, researchers, physicians working on the diabetes issue, and they have developed real, true care plans that if a patient follows on a regular basis, they're going to stay healthy as a diabetes patient. The problem is a lot of people don't follow the care plan. There's part of human nature that tells them, I don't have to do this today. I don't have to worry about it. With our system, that's going to show up in the blood glucose data, and we'll be able to intervene with those folks. So the care plans and the experts, we really need them to tell patients how to act, but we also have to monitor the patients regularly and make sure they're acting in that way.
Bill Smith, my guest today. If you're a physician's group or a doctor wanting to learn more, or just a potential consumer wanting to find out about this exciting company, they're already rolling it out with the Kansas City Metro Physicians Association. You can find all the information on ALRT at ALRT.com. Bill, I want to thank you for your time today.
Thank you for having me.
Bill Smith, my guest, the president of ALRT. You are coast to coast and worldwide at GoodLifeRevolution.com.